Now, hello and welcome to this webinar. Today we're going to talk about how restorative therapies, integrated functional electrical stimulation therapy systems can optimize rehabilitative outcomes in the neurological populations. As Sandeep and Dr. Bala mentioned, my name's Wendy Warfield. I'm the Clinical Education Manager at Restorative Therapies. I am an occupational therapist by background, specializing in neurological rehab for the last 18 years. I have experience working with both adult and pediatric populations in both inpatient and outpatient settings, and I've worked with patients with a wide range of neurological conditions. A little bit about restorative therapies as a company. We are the leader in integrated functional electrical stimulation therapy systems. We began our work with electrical stimulation therapy systems in 2005 and have a full continuum of care product line that we manufacture all of our systems in our headquarters in Baltimore, Maryland, in the United States. Our mission is to help individuals with neurological impairments or critical illness to achieve their full recovery potential. And our vision to achieve this is to make our products available and accessible to all individuals and organizations who can benefit from their use. So just as a small snapshot here, we have over 4,000 patients who utilize the systems in their home on a regular basis. Those are patients living with neurological conditions with resulting chronic paralysis. We also have systems in over 1,000 clinics worldwide and well over 100,000 patients in our database, which is called RTI Link, that we'll be reviewing a little bit further on in this presentation. Over the last, fast there. Over the last 15 years, we've observed a global paradigm shift in neurorehabilitation practices with the adoption of advanced rehab technologies to improve patient outcomes and in therapist efficiency. Restorative therapies products are being used in neuro rehab clinics and patients' homes all around the world, which are reflected here in the countries that you see in blue. And there's a little yellow star here in the US, kind of around where our headquarters is located here on the East Coast of the United States. And here in the United States, we have over 600 clinics that utilize our equipment, and these are all of our model center neuro rehab clinics that serve patients with spinal cord injuries, stroke, multiple sclerosis, and a variety of other neurological conditions. And it's being used as a standard of care. We do have an entire product line that can be used starting as early as in ICU to help patients who need mobilization very early on after an injury or disease process that they may be battling. The RT300 supine, which is a product here that you can see on the left, goes over a hospital bed and allows patients to begin using FES and mobilization very early on, even as early as ICU. A variety of other products can also be used throughout the course of inpatient and outpatient rehabilitation, and then ultimately for patients who need them long-term, either in their home or in community wellness centers. Our talk today is going to focus mostly on these two products and their role in neurorehabilitation. These are the RT300 and the Excite system. We also have a partial body weight supported FES integrated stepping system called the RT600 and an FES elliptical system that provides stimulation to arm and leg muscles simultaneously called the RT200. But we will primarily focus on these pieces of equipment for this talk. With regard to beginning early and helping offset some of the severe deconditioning and muscle atrophy that can occur very on after an acute injury, the RT300 supine provides the ability for patients to undergo leg or arm cycling while stimulating up to 12 muscle groups in either their arm, leg, or core muscles. So here are some images of some patients who are utilizing the RT300 supine in an ICU environment. This particular gentleman here, who has an acute spinal cord injury, is using FES for his arm muscles, and you can see he's actually positioned upright in a chair. And this person here is utilizing the leg cycling component while stimulating leg muscles in a supine position in a hospital bed. So we found that RT300 supine is a very wonderful tool to add to an early mobility program. And then finally, when your patient is able to tolerate upright sitting, it's going to be a transition then to our upright version of the RT300, which provides the same type of FES integrated with an ergometer. You can do arm cycling with 12 channels of stimulation to arm muscles or core muscles, as pictured here on the left. And then here on the right, you can also utilize the system for stimulating leg muscles in coordination with leg cycling. And again, you can use this as a 2-in-1 therapy system. We also have a pediatric model that allows children to begin therapy very early as well. We know that with children in rehabilitation, they're very neuroplastic and often making a lot of changes. And so this enables us to use intensive FES with them very early on. And today we're also going to talk a little bit about our Xcite system, which is a little bit different from the motorized systems that we just talked about in the past two slides. And this particular system is going to focus on use of FES, pairing it with tasks. So this is going to be functional tasks like reaching, sit to stand, various activities that therapists may be doing with the patient, but they can utilize the electrical stimulation in coordination with that task to help patients engage their weak or paralyzed muscles to be more active during that task. So that's a little bit of a snapshot of some of our systems, but let's get into some of the rationale about what is FES, what is activity, and who's going to benefit from this. So who can use an integrated FES therapy system? Well, these are used with anyone who has an injury or a disorder of the central nervous system that results in muscle weakness or paralysis. These would be conditions such as spinal cord injury, traumatic brain injury, stroke, multiple sclerosis, cerebral palsy. And one thing to note is that patients must have intact peripheral nerves in order for FES to evoke a motor or muscle response. So inactivity itself has a profound impact on the health of an individual, whether they're neurologically involved or able-bodied. Everyone needs physical activity. Here are a list of potential effects of inactivity. These comorbidities too often result in decreased participation within the home and community. They can result in increased hospitalization or even death. Our challenge as clinicians is to determine how we can provide individuals living with neurological injuries or conditions the same opportunity to have the benefit of physical activity as all of us able-bodied individuals, and how we can give them that opportunity throughout their lifespan, even after they discharge from a rehabilitation program. Voluntary activity relies on an intact connection between the brain's upper motor neurons, so part of the central nervous system, and the lower motor neurons, whose cell bodies are in the spinal cord and are technically part of the peripheral nervous system. The axons of the lower motor neurons leave the spinal cord to activate the muscles, thus causing muscle contractions. When neurological injury or disease disrupts this pathway, FES can be used to restore activation of muscles below the level of the injury. FES activates intact lower motor neurons in the peripheral nervous system, causing a neurotransmitter release at the neuromuscular junction, which results in an involuntary muscle contraction. So as a result, we can use FES to restore activity to dormant pathways. And this is really important for our patients with neurological injuries. We want to make sure that we can provide them a pathway, an opportunity for them to maintain their muscle strength, their muscle health, their circulation, and so many other benefits. So we refer to our systems as IFES, and that's not always a term that therapists have heard a lot. But what we're referring to is the fact that we can take functional electrical stimulation, which is a complex treatment modality, and we can integrate it with a motorized system in the case of our RT300, which you're viewing here, or we can pair FES in perfect timing with specific task training, which is what we do for our Excite system. Our proprietary software, as you see here on the RT300, it provides real-time biofeedback, data tracking, and sophisticated control algorithms that are designed to support a wide range of patients with neurological impairments. Electrical stimulation is delivered to key muscle groups as determined by the therapist, and the stimulation is delivered to those specific muscles in perfect timing with the crank rotation so that all of the muscle contractions are very smooth and coordinated. And the software is constantly monitoring the patient's effort and controlling the stimulation and resistance in real time to give them their best possible outcomes. The stimulation options in terms of what muscle groups are available are very flexible. You have 12 channels or muscle groups that are available. You can apply these across a wide range of upper extremity musculature, lower extremity musculature, or core as well. And you can also determine how much stimulation you'd like to provide, whether you want to evoke a muscle response or simply provide a sensory input to the system. You can also select certain channels to be always on, which can be really key for stabilizing joints and also for reducing spasticity. All restorative therapies products have been cleared through the FDA, our regulatory body here in the United States. And there are many key indications, as you can see here: reducing muscle atrophy, improving circulation, improving or maintaining range of motion, reducing muscle spasms and spasticity, and helping to facilitate re-education of muscles. One really key indication I want to point out is for management of spasticity. For those of you that work with patients with neurological conditions like brain injury, stroke, spinal cord injury, we know that our patients, often have decreased quality of life and all types of range of motion concerns as a result of managing spasticity. And the FES evoked patterned reciprocal muscle activation that they receive through use of the RT300 is a fantastic way to manage spasticity long term. But beyond those 5 key labeled benefits, there are many, many studies that have looked at the benefits of FES ergometry or FES cycling, not only as a short-term intervention, but as a long-term intervention to impact many areas. So here are just a few examples of some of the studies that took a look at patients having increased arm function, improved gait, improved spasticity, quality of life, and many, many others. FES ergometry has also been looked at in the literature as a long-term intervention, something that patients can do well beyond their discharge from a rehabilitation facility, with many, many health benefits, potential neuroplasticity changes in their body, which may lead to increased function, as well as improved quality of life and overall physical health and integrity. We have a full reference summary related to all of these different areas. If there is a particular area of interest related to research that you'd like to delve into further. So what do we want to do with FES? Well, we want to use FES as a rehabilitation tool to help our patients be able to achieve their full recovery potential. And we know that the body has an ability to spontaneously recover some function in some cases. With neurological injury, it's always very different and unique. But we want to try to facilitate this concept of neuroplasticity by evoking as much activity in the nervous system as we possibly can, not only to strengthen muscles, but to provide a signal to those pathways, sending a signal back from that the muscle and the nerve all the way back to the central nervous system to help re-educate that pathway. So we know that when we provide FES to patients who have paralysis, that patients have demonstrated improved ASIA motor and sensory scores. Those are more specific to spinal cord injury. And they've also demonstrated decreased spasticity. And FES as well has been found to promote increased axonal myelination and increased neuron cell birth. So we believe that FES is a core principle in promoting neuroplasticity. And we know that the body itself really needs that high intensity activity in order for the optimal neuroplastic changes to occur. So one frame of reference in terms of a treatment paradigm is to provide an activity-based therapy approach. And in the literature, an activity-based therapy approach includes the following foundational items, including weight bearing, use of functional electrical stimulation to weak or paralyzed muscles, particularly below the level of an injury, task-specific practice, massed practice, which includes high intensity training, as well as locomotor training. And so when we look at these core foundations of ways that we can provide this high intensity activity based therapy to our neurological patients, we can use not only the FES through our systems, but we can promote doing that in a task specific way with our Excite system, which we'll talk a little bit more in detail about later, as well as mass practice or high intensity stimulation through our RT300 FES ergometer. There are only a few absolute contraindications to use of functional electrical stimulation, which is overall a very safe modality. Those are the top three that you'll see here. So pregnancy, stimulating in an area of an unhealed fracture, and for patients with cardiac demand pacemakers. There may be relative contraindications, and of course, clinicians are, encouraged to use their clinical judgment and talk to the physician. But some of those may include avoiding stimulation in the area of an implanted device, stimulating with patients with wounds or compromised skin integrity, and also range of motion limitations that cannot be accommodated. So let's talk a little bit about some of the features of our systems. All of the systems are very flexible in terms of stimulation options. So here's a list of some of the muscle groups that you may stimulate in coordination with the RT300 FES ergometer. That may include shoulder and scapular stabilization for proximal control. You may include core musculature like erector spinae for trunk extension or abdominals to help maintain that postural alignment during an arm or leg cycling session. A variety of muscles throughout the upper extremity and the lower extremity that would be selected by a therapist based on their evaluation of the patient and their areas of weakness. All of our systems have a wide range of stimulation parameters that can be adjusted. So for each channel of the 12 channels or each muscle group, you can determine how much amplitude, so how intense the stimulation is, the pulse width or how long each pulse is on in time, as well as the frequency, which is how often the pulses are delivered. And this has a major impact not only on making sure that you have, got the optimal muscle contraction, but also that that muscle contraction is very comfortable and tolerable for your patient. So the system is very flexible and you can adjust all three of these parameters for every single muscle group. So here's an example of what the RT300 controller looks like and how it's kind of measuring a variety of different outcomes in real time throughout the session. First, you'll notice there's an engaging avatar and a little virtual world that the patient can follow through. You can set a target speed for your patient and it reads their actual speed. And if the patient is able to meet or exceed the control speed that you've set for them, they're able to cycle above the motor without assistance. This little cogwheel down here in the bottom will indicate that by turning from blue to gray. If the patient slows down below their control speed, then the motor will be available to help continue to move them through the range of motion. And in that case, you may need to add more stimulation in order to help them meet their speed. When we think about someone going 30 revolutions per minute or 35 revolutions per minute, we can think about 35 muscle contractions per minute. This is very high intensity stimulation, and it's a very effective way to deliver a high dose of stimulation to the nervous system. And the reciprocal muscle firing across the joint is very inhibitory for spasticity. So here's an example of a patient who does not have any active or volitional movement below the level of his spinal cord injury. In this particular example, this gentleman has a T6 Asia A spinal cord injury, and he is stimulating his quadriceps and hamstrings, tibialis anterior and gastroc. And as you can see there, his quadricep is firing as the pedal moves forward, and then his hamstring is firing as the pedal comes back toward him. So you can really see, even though he has no active movement, the involuntary FES evoked muscle activity that's happening in his lower extremities. And here's an example of upper extremity FES cycling, where this particular patient has weakness throughout the uppers. So she's using stimulation on her deltoids. She's using stimulation on her biceps, triceps, wrist extensors, and there are some different types of supportive arm trough pedals that help to unweight some of the weight of the arm in order for the patient to have improved proximal stability. You can also include core musculature, such as abdominals or erector spinae, with arm therapies. And I found it's very helpful to stimulate the erector spinae to facilitate trunk extension so that patients can maintain an upright posture while participating in this therapy. One really key thing about the RT300 and all our systems actually is that we have the ability to stimulate the shoulder, the deltoid and infraspinatus as shown here, in order to correct a subluxation. We know when the deltoid becomes very weak and overstretched that the humeral head starts to come down and out of the glenohumeral fossa. And so we really want to make sure that we can provide that joint integrity so that patients stay safe and also benefit from strengthening during arm cycling motion. So in this particular case, you can actually turn this channel on constantly and protect the glenohumeral joint, moving the humeral head back up into position and stabilizing it there throughout the session. And as you can see here in this photo, in our software, you'll be able to see, even if you're not familiar with use of electrical stimulation, a suggested electrode placement and electrode size for every muscle group. So for clinicians who are not used to using FES, this provides a really great tool to help you get started. So moving on a bit from motorized integrated FES, it's also really important to understand the benefit of FES integrated with a functional task. Oftentimes, we'll begin a session by using the RT300 to help reduce spasticity, increase range of motion because of that very high intensity. But then we can move over to use of our Excite system to practice specific functional skills or activities the patient's working on in therapy.
Okay.
And if you've been using the RT300, for example, for lower extremity, you could actually unplug the stimulation cables from the RT300 and plug them right into your Excite with the electrodes already on your patient and move from a cycling task to a functional task. With our Excite system, there are 4 libraries of functional tasks that are integrated with FES for upper extremity, lower extremity, general activity, which includes core and other transitional movements and mobility skills, as well as the hand library for more fine motor activities. So here's an example of some patients participating in activities with the Excite along with their clinicians, showing self-feeding, forward reach. You can focus stimulating more proximal muscles or more distal muscles based on what your patient needs. And there's a variety of other different tasks as well. based on the area that your patient's working on, whether it's upper extremity, lower extremity, or core. Here in this particular clip, there's a pediatric patient who's working on transferring from a wheelchair to a mat. She is focusing on core control and core stability. And so she has stimulation to her glutes, her rector spinae, and she's working on stabilizing her core during a dynamic reaching task. In this particular example, this patient is working on postural control. He has stimulation on his back, abs, working on weight bearing while doing postural control activities with facilitation from the clinician, and also working on pushing up against gravity. So there's a variety of different ways you can utilize this system, whether your patient is high functioning and able to stand and perform standing mobility, or whether your patient is lower functioning and they need to work on activities in prep inside lying. So Xsight has 40 different tasks that are fitted for a wide variety of patients. This system itself is very flexible. It comes with a rolling cart, and the top, which is the stimulator, can be used on a tabletop or a mat surface. The screen can be removed, so it's very easy to work with, and has, the 2 stimulation cables allowing for 12 channels of stimulation. So here are some of the activities that are included in the libraries. With regard to upper extremity, there are forward reach and grasp and a variety of other reaching patterns, including forward, overhead, and lateral, as well as a variety of ADL skills that patients may be working on and to improve their independence, such as self-feeding, brushing their teeth, brushing their hair. The hand library focuses on various prehension patterns, such as gross grasp and release, lateral pinch, tip pinch, and a variety of others. The lower extremity library includes a wide range of activities for higher mobility patients that can perform sit to stand, squats, or other activities in a weight-bearing position, as well as some activities that are more for patients who are lower functioning, such as hip and knee flexion and side lying or heel slides. The general activity library includes a variety of mobility skills and neurodevelopmental transitional movements, such as quadruped or heel sit to tall kneel, as well as transfers and others. So there's a wide variety of activities you can pick from that clinicians are most likely already working with their patient to perform. So the inclusion of FES can help their weak or paralyzed muscles become more active during this activity, as opposed to patients simply relying on only their stronger muscles and compensating. So adding FES to upper extremity activities has been supported as well in the literature, showing improved upper extremity functional use, improved self-care capability, and improved motor control. And adding FES to lower extremity treatment interventions has also been supported in the literature for improved function and control and increased lower extremity muscle mass and strength. So we know that adding FES can really help facilitate an improved outcome for our patients versus just doing the task alone or with only manual facilitation from the clinician. So our Xsight system looks like this when you first see it. You'll be able to select a library, and then you'd be able to select an activity from the library, in this example, forward reach and grasp. And via this avatar, you can preview the motion or activity that you would like to perform with your patient. And you can add that activity to their customized library. This is what an actual activity within Xsight looks like. You have 12 channels of stimulation, 6 channels for the left side, 6 channels for the right side by default. And those channels can be reassigned to other muscle groups based on what muscle group the patient needs and their specific areas of weakness. You can also view a photo for every single muscle group. Again, if you're not as familiar with FES, so it makes the setup very, very easy for clinicians to learn. And it gives you a great foundation to start testing their muscles to make sure that you're going to get the correct movement that you're looking for. All of the muscle groups are preset to turn on, stay on and then turn off in preset timing. So for example, here, the scapular stabilizer is in this core stability pattern. So you can see they're color coded, that the muscle group is preset to a timing. And there's also little audio cues that will cue the patient when to open their hand, when to close their hand, and when to open again during the activity. You can also make this program faster or slower based on your patient's needs. There's also an avatar, which will provide a visual feedback for the patient. And these buttons here allow you to perform the task either unilaterally, left or right, or bilaterally, as well as to pause at any point during the program, to stop after a single rep, or to stop the program. So here's just a quick example of what it would look like in action when muscles are firing in a dynamic sequence. And you can see how they're turning on and off in specific timing here in the pattern. And then they're looping, so the patient is repeating the activity over and over. And back to our foundations of activity-based therapy, we know it's important for patients to have high repetition. And so we really want to promote the repetition of this task-specific practice over and over and over to really reinforce this pattern. So your Excite system can be utilized with a variety of other activities or a variety of other pieces of equipment that you may already have in your rehabilitation space. So some examples are working with a patient to perform pre-gait activities in parallel bars. You may be stimulating their weaker muscles to help reinforce that more natural physiological stepping pattern so that they have better outcomes. You may be using a mobile arm support to unweight the upper extremity during an ADL or task of self-feeding here, but you can also facilitate stimulating the weaker muscles along with that unweighting so that the patient is not compensating and only using stronger muscles, but also involving their weaker muscles. You can use partial body weight support, standing frames, and a variety of other pieces of equipment you may already be using in treatment along with the Excite system. So here's a case example of a patient with a brain injury. This gentleman had a traumatic brain injury as a result of a motor vehicle accident, and then also subsequently had a CVA years later. So this patient presents with bilateral upper extremity weakness and spasticity, as you can see. And in this particular activity, the clinician is helping him learn to move his trunk from lateral flexion into midline. And this is a key component of a bed mobility skill. And you can see here in this video that the patient requires assistance, hand over hand assistance, to bring his hand from the flex position into a more functional weight bearing position. So the therapist is assisting him. At this point in time in this video, although the pads are placed over his weak muscles, the stimulation has not yet been turned on. So the therapist is asking him, show me what you're able to do without help from the stimulation. And as you can see, she's having to help him with two hands complete the activity. And even though he's trying to weight bear through his hand, his wrist keeps popping back into this flexor synergy pattern. So here's an example of what the patient's able to do with the Excite system, providing FES to his weak muscles. So he's actively looking at the avatar. That's why he's looking over to the screen to see when he should push up. He's then able to maintain more weight bearing through his hand with his wrist extensors and triceps being stimulated so that he can get a more functional push through his left arm to right his trunk from that lateral flex position up to midline. And as you can see here, especially on this second rep, as he's coming up to midline, the therapist is barely having to help at all. She's only using one hand to facilitate versus having to use two hands up. She even left go for a minute. So he was really able to actively utilize his own muscles to perform this task with less and less physical assistance from his therapist. So this is just a great kind of example of the motor learning and the muscle re-education that's happening with the use of Excite during a functional task. And then the goal would be for this patient to then perform without the FES repetitions and see if there's any immediate carryover. Here's an example of a patient with multiple sclerosis who has a lot of weakness throughout the upper extremity, and you can see quite a bit of atrophy throughout her hand. She's performing a forward reach and grasp activity for strengthening of her hand, and she's repeatedly performing this task, working on finger flexion and extension with a little bit of stimulation through her proximal upper extremity as well. So those are just some examples of how patients with various diagnoses may benefit from utilizing Xlite as a strengthening tool and a tool to facilitate muscle re-education to help them improve their independence and functional mobility. So all of our systems are cloud-based. They all connect via Wi-Fi to our database called RTI Link. And this is a fantastic way for not only efficiency for the therapist to be able to establish a customized program for their patient that will save and be stored in the database, but it also tracks all of the outcomes. So we're able to take a look at every session a patient has completed and all of the variables of those sessions to ensure that they're progressing. This also gives us an avenue for telehealth, which for us here in the US has been very important during COVID. We've actually been able to log directly into clinicians, controllers, and clinics to provide them support remotely. And we've been able to log directly into the tablet controllers for patients at home to be able to provide them support and ongoing training so that they can be successful. And through our RTI Link database, we're able to track their progress and ensure that they're continually progressing, and also make changes as needed to their therapy program, to their stimulation parameters or therapy settings. So patients that have chronic paralysis who need a long-term opportunity to be able to undergo physical activity can't stop doing this activity when they leave rehabilitation. They need an opportunity to be able to utilize this type of technology throughout their lifespan, ideally 3 to 5 times a week, in order to stimulate their muscles enough to have an impact on their health. So 80% of all of the systems that we sell from Restorative Therapies actually go directly to patients to use in their home. And many other patients utilize these through wellness centers in their community. So patients with long-term neurological injuries that need this ability to be able to stimulate their muscles really benefit from use of RT300 throughout their lifespan. They'll make improved gains and capitalize on the gains that they've already made in therapy. They're often less likely to be rehospitalized because they're avoiding some of the profound secondary complications of being immobile. It's a very efficient way for them to utilize stimulation, and we have the opportunity through our systems to be able to provide them ongoing telehealth support from providers. So we did a sample of 150 patients who were long-term users of the RT300 system at home, and these are some of their self-reported health benefits. And most profoundly, they're reporting improved muscle mass and strength, less spasticity, and overall improvements in their health, as well as a variety of other positive health outcomes. So when you're developing a plan of care for your patients, the RT300 and the Xlite are two fantastic tools that are integrated with functional electrical stimulation that can be used in two different ways to help patients achieve the very best outcomes. With the RT300, you're able to provide massed practice FES. So for example, 300 repetitions of muscle contractions in only 10 minutes, which has a profound impact for reducing tone and spasticity. And it also allows patients to be able to undergo progressive resistive activity. And in many cases, there's no other way for them to be able to do that with their weak muscles. They can also then achieve a power output that can influence their overall health and wellness. And with the Xlite system, we can help them utilize FES in a very meaningful and engaging way to perform specific tasks that they're working on to help them improve their independence and their daily living skills. So in summary, these systems are very flexible. They're used in a variety of different ways, not only in rehabilitation settings, but also throughout the lifespan to help our patients optimize their outcomes long term. And so at this point, I'm happy to open it up for questions. I also provided my email contact here. So if you do have follow-up questions after this presentation, please feel free to reach out and I'm happy to provide any additional information.
Thank you, Wendy, for your session. Very interesting. I think there are some chat questions being requesting. Can you see the chat line?
Yes.
Yes.
Let me take
question is, how much
here.
repetitions would be beneficial for a patient before you see improvements? And is this number of repetitions set in Excite equipment? I suspect that you've answered the last part quite clearly, that the Excite equipment sets up things, right?
Yeah, so it really depends on the specific patient and what they're able to tolerate. But the Excite specifically, all of the activities are set to indefinite number of repeats. So you can stop at any point in time if your patient is fatigued and needs a break. It really depends on the activity that you're doing. If you're doing a sit to stand where you're standing against gravity, you may not do as many as, for example, a smaller muscle group where you're doing reach and grasp. So it depends on the muscles you're stimulating and the tolerance of the patient. And you can repeat the repetitions as many times as you would like. Ideally, you would want to stimulate the muscle at least 3 to 5 times a week for at least 30 minutes in order to really start to see an impact in muscle bulk.
Okay. Wendy, before I'm going to pull out the next question, but would you like to close your screen so that the PowerPoint presentation is not there, right? Okay, the next question is, let me get it right first. Where is it? How soon would you start your IFES system for a neurological patient? Would you start during the recovery stage of healing process, or is it at a certain time frame when you start the therapy? I think the question is, when do you start the use of the IFES? Yes.
Yeah, so patients can start using FES even as early as when they're still in intensive care. Generally, the rule of thumb for spinal cord injury patients specifically, because they can be in spinal shock, is about 2 weeks after their injury would be safe to start functional electrical stimulation. Other patients with stroke or brain injury may be able to start sooner than that. We have in the ICU unit begun stimulating muscles for patients who are still completely sedated and ventilated on mechanical ventilation. So you really can start using FES very early to help offset some of the profound muscle wasting and atrophy that starts very, very early on after an acute injury or during a disease process.
Okay. I believe that person is Malathi. Malathi, is that answered your question? Malathi?
Yes.
Do you have any? Yeah. Do you have any further questions you want to ask before I move to the next question?
It's okay. I think I understand it. Thank you very much.
Okay, good.
Thank you, Wendy.
You're welcome. Thank you.
The next question is, can we use it on patients with cerebral palsy?
Yes, actually, FES is fantastic for patients with cerebral palsy. There are studies that show that use of FES with these patients can help improve their outcomes for walking. And also it can be a really profound impact on the spasticity and tightness that our patients with cerebral palsy experience. So yes, FES is a fantastic tool for this population, and it is also supported in the literature.
Sorry, just as an add-on question, is it used? I mean, do you have a system for children as well, pediatrics, FES?
We do, yes. So the RT300 has a pediatric version, and I did show that in the beginning.
Right.
It's just a little bit a smaller unit and specialized pedals that can accommodate small limbs for children. You can use it with children usually as young as 4, sometimes even smaller with special accommodations. So 4 years old is technically our indication, but we have used it with patients as young as 2 years old. And so it's really fantastic for those cerebral palsy patients to get them started young. It can also really help reduce some of the spasticity that they experience to help them offset, joint contractures from occurring. These patients typically need, surgeries like tendon lengthening surgeries throughout their lifespan. And, we may be able to help offset some of that by regular use of FES. So yes, definitely encourage you to explore use of FES with that patient population.
Okay, Santox, is that answer your question, Santox?
Hi, yes, sir.
Yeah.
So
And I think it's quite obvious that you need to have cognition to be able to use IFES.
Oh.
So your second
Well,
part.
The one thing that I can add though is, if you are agitated and you're fighting the pedal motion, such as emerging from a coma after brain injury, that may not, work very well. But we have been able to use it with patients who are completely nonverbal, patients who are completely sedated, and just really monitoring their vitals and their physiological stability, looking at their heart rate and their respiration rate, for patients who are nonverbal and or sedated. And so we have been able to use FES successfully with those populations.
Wendy, I have a question.
Thank you very much.
I understand restorative therapies, FES is integrated with pedaling or the cycling. My question is, if we compare it with non-integrated use of FES and cycling to restorative therapies, FES integrated with cycling, is there a study which says it's better? If not, how do you think it's better, and how much better it is for spinal cord injury patients?
Yeah, it's very difficult to perfectly coordinate stimulation to muscles during cycling unless there is an optical sensor, for example, like we have inside the cycle that knows at which point in time a muscle is, moving the pedal forward and should be firing, or the muscle is, should be flexing and pulling the pedal back. So because we have that technology built into our system, we're able to fire the muscles in perfect coordination with the pedaling motion, and that reciprocal firing, flexion, extension over and over is what's really key for spasticity. If you didn't have the stimulation integrated, the firing would not be appropriate and could possibly be firing the muscles, and even maybe fighting against the pedals. So, definitely that integration that the system provides is very complex, and it provides a really high intensity therapy that's very safe, so that the patient's able to, produce a muscle contraction at the right timing. We also have a gait pattern built in, so it fires the muscles in a physiological stepping pattern to reinforce that pattern as well. So again, if you were just to provide like a handheld stimulator and try to coordinate it with the pedal motion, it would be really difficult to do that and expect to get the right result.
Yeah, thanks.
And sorry, just to add in, I think it's important to realize that the FES is designed for functional tasks. In this case, they use a pedaling bicycle. And so when you're using that, you automate the activity. In other words, if you were to use a simple FES, you would not automate the activity. You would just be stimulating a muscle. And it's just a local spinal cord response rather than a cognitive response. So when you do some functional tasks, you activate a pattern in the brain. And let's be honest, we all walk around. We don't think about how we walk or how we cycle something when it's automated. So I think FES has got the advantage, or in your system, has got the advantage of automating activity. Am I right for that?
Yeah, definitely. Because we're able to provide such high intensity stimulation, and like you said, in that patterned reciprocal, muscle firing over and over again, it does activate patterns of central generators, which are clusters of cells, central pattern generator cells in the spinal cord, and that those are responsible for, like you were mentioning, reflexive stepping and things of that nature. So absolutely, because FES is sending that signal back up through that peripheral pathway back to the central nervous system. The stimulation doesn't just flow down and make the muscle contract. fact, it also goes back up the system through the peripheral nerve back to the central nervous system, and it does activate those central pattern generator cells. And we believe that use of FES in that way is what is helping to promote neuroplastic changes and help patients with some spontaneous functional recovery. So yes, I agree.
Okay, we'll allow 2 questions. Anybody else? First come, first serve. Okay, going once. Going twice. Okay, Sandeep, I'll leave you to close the session, Sandeep.
Yes, thank you, Wendy. I think it was excellent presentation and so much of new information has been added. Also, we thank you for staying awake so late to educate us. We will repeat the same session in few hours for those who couldn't attend, because some of the clinicians were not able to attend due to the patients already been booked for them. So we will have the same session attended. Of course, they will not be able to communicate with you directly, but we are going to also we'll be playing the question and answer session as well. Thank you very much. And I thank all the participants as well. Someone has asked for, Wendy, someone has asked for your email. I think, yeah, so the email is there. Don't ask for personal numbers. I think she's pretty, so I'm sure some of them want that, but that's okay. Thank you, Wendy. Take care. Good night, and we'll see you soon again. Thank you. Bye-bye.
And I like to say thank you again for Wendy. It's really late at night now. It's 10 o'clock in the evening, and she sacrificed that late night, not having time with the children as well to prepare things. Thank you very much. Well done.
Thank you.
Oh, thank you very much. It was a pleasure. I'm so glad to be able to share this information with you. And, thank you to everyone who attended. We look forward to, hopefully having you be able to adopt this equipment into your neurorehabilitation programs to help your patients. Thank you very much, everyone.
Thank you.